21. We appreciate you joining us today back in the SuperTalk studios. Joining us now, Dr. Katherine Pannel, psychiatrist. And you're going to talk to us a little bit about the holidays, which seems to be a particular challenge for those that might have some mental health challenges.
Yeah, most people have this whole Norman Rockwellian picture of the holidays about how it's going to be perfect, wonderful time spent with the family. And for some it is, but for a majority of us, it's actually a really difficult time. A lot of firsts for people, especially with COVID. It might be a first Christmas losing a loved one or an anniversary of losing a loved one. So it's not just all happiness for a lot of people.
What are some of the, more prevalent kinds of mental health clinical issues that someone might have that are of particular problems during the holidays?
Well, depression is a main one, especially with the time change. We're seeing an increase in depression and seasonal affective disorder, but also with COVID and the numbers going up, more people are having to isolate. So depression, anxiety, it's all on the rise.
What about loss of a loved one? Can that trigger also these kinds of issues?
And those are the things that you don't see, like on social media and Facebook. Like you see the, first Christmas for the babies and first Christmas married, but a lot of people it's maybe the first Christmas that they've had without a loved one. So it can actually be an anniversary and a hard time for most.
Yeah, absolutely. So, all right, so what do you do? How do you deal with this? What do you recommend?
Well, you got to start employing healthy coping mechanisms and stay away from the negative coping mechanisms. We've seen a lot more substance abuse, the increased rates of overdose. So you have to stay away things that are negative to cope, and really rely on family and your support system.
How much has COVID, the quarantining, the lockdowns, lockups, and all the other stuff that has just surrounded the pandemic, how much does that figure into this?
It has figured into it a lot, and I did not realize how much until I actually got COVID myself, how awful the actual quarantine is. Just now coming out of quarantine, I came out on Christmas Day, and it was something. I've been vaccinated, boosted, so the first 2 days I was sick, got antibodies, but then for the remaining 8 days, it was pretty depressing and isolative. It was during the holidays. I couldn't be around my kids, and it definitely will exacerbate depression.
So you think you had the Omicron variant?
I know I had it.
You had it sequenced? Yep. Okay. Yep. All right. So your case seems to be aligned and be consistent with what's been reported. Relatively mild conditions, more likely to break through vaccination, but not serious illness, though, right?
No, and I think when I found out, I was actually really mad because for the past 2 years, I've done everything that I was supposed to do, masking. I got vaccinated, I got boosted, but I did go on a girls' trip to New York. And even though they required masking and, proof of cards, I still somehow managed to bring Omicron back with me.
Yeah.
Yep.
And I don't want to dig too much into that because we could spend a couple of hours at least
Absolutely.
talking about it. But I just have this feeling that almost like the common cold, every person on the planet's going to get this eventually.
Yeah, it seems to be much more transmissible than the other strains, for sure.
And that's been the book. But the good news is it seems like there are more reports coming out that suggest immunity once you contract and are infected with Omicron, and virtually permanent immunity to future strains. It's based on what is known today. So that may be, frankly, it's kind of like chickenpox, how we get out of this thing.
Yeah, one can hope that the Omicron is going to actually, be the variant that wins the day. It beats the Delta variant, and that it has a mild course, and that it kind of, for lack of a better word, burns through the population and then becomes a dominant strain, and we're over this mess.
Yeah, I think there's a lot of scientists that are predicting that. All right, so back to mental health. Where does Mississippi kind of rank amongst the states in terms of the occurrence and the rate of mental health and mental illness?
We do have high rates of mental illness, but the sad part is that our mental health system ranks pretty poorly amongst other states.
So our system, like our treatment systems, our support systems, and so forth?
Yes.
Okay, well, explain that. They're broken.
Well, and we've got a federal lawsuit going on because of it right now. We tend to over-hospitalize mentally ill patients. We need to, revamp the outpatient system and make it stronger so that we can keep these patients at home with their support system instead of over hospitalizing them. Once you go in the hospital, you lose your rights. I mean, you're behind a locked door, you're without your social system, and it can be, pretty traumatizing. And we need to make our outpatient mental health system stronger to keep them from actually having to go into the hospital.
And so what's the alternative approach, treatment approach, if they don't put them in a hospital, essentially?
Right. Well, the federal government's actually been very generous in giving our state ample money to actually, have a strong outpatient mental health system. And this is when our community mental health centers really need to step in. We have money funded towards PAC teams that should be able to go into the homes of those with the mentally ill, address their needs there, because sometimes there's fear surrounded in going into the clinic to get care. So, I mean, we have the services. We just need to utilize them.
So is it fair to say then it's not a function of money? Money's not the issue?
Money is definitely not the issue.
All right. What about healthcare resources, healthcare professionals in this practice area?
Well, psychiatrists are scarce in all of America. I mean, we don't have enough, but I mean, we do have good services outpatient. We just need to utilize them more. We need to make them more available and make them stronger.
Yeah. Explain for the benefit of our audience, Katherine, the distinction between a psychiatrist and a psychologist.
A psychiatrist is a medical doctor. They go to medical school for 4 years, and then once they graduate from medical school, they go into a residency, which is an additional 4 years of training. We do therapy. We're trained to do therapy. We are also able to prescribe medications, whereas psychologists are fantastic and they're needed and do a great job with therapy. They're unable to prescribe medications.
I got you. So is it true that a lot of these issues, mental health issues, are in fact a physiological problem, that they're caused by something that's just awry?
Right. Mental illness is an illness. It's just like hypertension, diabetes. It is an illness and it should be treated as such.
And that's what the medicines and the drugs and the
Correct.
therapy, I assume?
Yes. I mean, and therapy is huge. I mean, the gold standard of treatment is therapy and medications, but there are chemical imbalances in the brain that we know that medications help.
Yeah. I actually had a lawsuit 20-something years ago that was filed by an employee that it took 2 years to find out, but was being treated, was clinical. And we didn't know. We didn't know when we hired her and didn't even know when the suit was filed. But when you start digging into medical records, you find out. And that's exactly what it was. It was actually deposed a psychiatrist as part of the legal proceeding, who said that, this is a function of, this is not caused by other people, this is caused by an imbalance, a chemical imbalance. Dr. Robert Ritter, you know him?
I don't.
I'm not sure if he's still around anymore, but that was fascinating. Anyhow, I digress a little bit, but you don't know.
No, and that's, I think, one of the problems in Mississippi is we don't talk about it enough. There's still such a stigma surrounding mental health treatment, mental health care in Mississippi that we have to talk about it more so that we can break down that stigma. So we don't know, and it's because we don't talk about it enough.
What are the warning signs, the so-called red flags, that a person or a close friend or a member of their family, anybody that's around people, should look for if they need to encourage them to seek treatment?
If you notice a personality change, something in that person that you notice, if they're starting to isolate more, they're getting quieter, they're not socializing, they're staying to themselves, just an overall personality change, it's time to start asking those important questions. They might not be sleeping as well, they may not be eating as well, but once you notice that change, it's time to talk.
Is there something different, Doctor, with respect to a child, an adolescent, an adult, as far as mental illness manifesting itself?
You have to look closer for children because they're not able to verbalize their feelings as much as adults. So, I mean, it's really looking at those cues to notice like a change in their personality. Kids, they tend to have more nightmares. It really affects their appetite more. When they're depressed, they tend to act out more. They get agitated, they get aggressive. You just have to really watch for those signs more and actually initiate the conversation because they're likely not going to come to you and start that conversation. So
the message then to parents, to guardians, is just to be observant.
That's correct, yes.
Wow. Well, appreciate it. That was insightful and fascinating, and let's just hope that folks around the holidays can deal with this, and if they need help, they just need to go get help.
That's right.
Yeah,
the services are there. You just got to go get them.
Appreciate it. Hope you had a great Christmas and a Happy New Year. Let's have a good year next year.
Yes.
Middays, we'll take a break right here. We'll come back.